Welcome back to the channel. If you or someone you love struggles with asthma, you know how challenging it can be to manage. Today, we're diving into a fascinating topic: the benefits of herbal medicine in treating asthma patients. We'll explore natural remedies that can complement your treatment, improve lung function, and reduce symptoms like wheezing and shortness of breath. But remember, always consult your healthcare provider before trying any new treatment. Asthma is a chronic respiratory condition where the airways become inflamed and narrow, making breathing difficult. Triggers can include allergens, pollutants, stress, and even exercise. Common symptoms of asthma include shortness of breath, wheezing, coughing, especially at night, and chest tightness. While conventional medications like inhalers and steroids are effective, some patients look to herbal medicine for additional support. Let's explore why herbal remedies are gaining popularity. Herbal medicine has been used for centuries in cultures worldwide, from Ayurveda to traditional Chinese medicine. But how can it help asthma patients? The benefits of herbal medicine include reducing inflammation, relaxing bronchial muscles for easier breathing, strengthening the immune system to prevent asthma attacks, and offering fewer side effects than some synthetic drugs. Herbs like turmeric, licorice root, and ginger contain compounds that act as natural anti-inflammatories, making them ideal for managing asthma symptoms. Let's break down some of the most effective herbs for asthma management and how they work. First, turmeric, or curcuma longa, is a powerhouse herb, especially for asthma patients. Its active compound, curcumin, has strong anti-inflammatory properties that help reduce airway inflammation, improving airflow and minimizing asthma attacks. You can mix 1 teaspoon of turmeric powder into warm milk or herbal tea and drink it once daily. For an added health boost, consider using golden milk, a traditional turmeric-based drink. Pair turmeric with a pinch of black pepper, as the piperine in black pepper significantly enhances curcumin absorption, making it even more effective. Next, we have licorice root, or Glycyrrhiza glabra. Known for its soothing properties, licorice root helps calm inflamed airways and acts as a natural expectorant, clearing mucus and improving breathing. It also strengthens the respiratory system over time. You can brew licorice root tea by steeping 1 to 2 teaspoons of dried licorice root in hot water for 10 minutes. Drink this soothing tea 1 to 2 times a day, especially during flare-ups. However, be cautious, as licorice root may increase blood pressure if consumed in large amounts or over a prolonged period. People with high blood pressure or those on medications should consult a healthcare professional before use. Lastly, we have ginger, or Zingiber officinale. Ginger is packed with gingerol, a compound known to relax the muscles in your airways, improving airflow. It also has anti-inflammatory properties that reduce swelling in the lungs. You can prepare fresh ginger tea by steeping a few slices of ginger in hot water for 10 to 15 minutes. Add honey or lemon for extra flavor and health benefits. Ginger can also be added to soups, stir-fries, or smoothies. For a double dose of anti-inflammatory power, combine ginger with turmeric in a tea. Thyme is a natural bronchodilator, which means it helps open up airways and makes breathing easier. Its antimicrobial properties can also help prevent respiratory infections that trigger asthma attacks. Add a teaspoon of dried thyme to hot water to make a simple herbal tea. Alternatively, use thyme essential oil in a steam inhalation, add a few drops to hot water, cover your head with a towel, and breathe deeply for 5 to 10 minutes. Use thyme as a seasoning in your meals to incorporate its benefits into your daily diet. Boswellia, derived from the resin of the boswellia tree, is a natural anti-inflammatory agent. It works by inhibiting leukotrienes, substances that trigger inflammation in asthma. Regular use can help reduce the frequency and severity of asthma symptoms. Boswellia is commonly available as capsules or in powdered form. Take as directed by a healthcare provider. You can also prepare a mild tea using boswellia resin or use it as an incense to enjoy its soothing properties. Look for high-quality boswellia supplements labeled with Boswellia serrata for the best therapeutic effects. These herbs are nature's gift for managing asthma effectively. While they can significantly improve symptoms, remember to integrate them with a healthy lifestyle, regular exercise, and proper hydration. Always source high-quality, organic herbs for maximum benefit and consult your healthcare provider before adding them to your routine. Managing asthma effectively goes beyond herbal remedies. Adopting supportive lifestyle practices can amplify the benefits of natural treatments and provide long-term relief. What you eat has a direct impact on inflammation and lung health. Foods rich in omega-3 fatty acids, like salmon, mackerel, chia seeds, and flax seeds, are excellent for reducing inflammation in the airways. Incorporate leafy greens, turmeric, and berries to further enhance their anti-inflammatory benefits. Eliminate or reduce processed foods, dairy products, and sugary snacks. These can increase mucus production and worsen airway inflammation. Spicy and fried foods might also act as irritants for some individuals. Start your meals with a salad made of spinach, walnuts, and a drizzle of olive oil for a lung-friendly boost. Strengthening your lungs can help improve airflow and reduce asthma symptoms over time. Focus on deep, slow breaths that engage the diaphragm. This increases lung capacity and promotes relaxation. Sit or lie down in a comfortable position. Place one hand on your chest and the other on your belly. Inhale deeply through your nose, allowing your belly to rise. Exhale slowly through your mouth. Repeat for 5 to 10 minutes daily. Useful during an asthma flare-up, this technique helps control shortness of breath by slowing down your breathing. Exercise can improve overall lung function and help reduce asthma severity. However, it's crucial to find a balance and avoid overexertion. Activities like walking and swimming are excellent for building endurance without triggering asthma symptoms. Swimming, in particular, can be beneficial because the warm, humid environment is gentle on the airways. Start with 15-minute sessions and gradually increase intensity. Always keep your rescue inhaler on hand and consult your doctor before beginning any new exercise routine. Keep your environment asthma-friendly. Your surroundings play a significant role in preventing asthma triggers. Use HEPA filters to remove allergens like dust mites, pet dander, and pollen from the air. Keep your home well ventilated but avoid exposure to outdoor pollutants. Avoid strong irritants. Chemical cleaners, perfumes, and scented candles can irritate the airways and trigger asthma symptoms. Opt for unscented, natural cleaning products instead. Control humidity levels. Use a dehumidifier to maintain optimal indoor humidity, which is 30 to 50%, and prevent mold growth, which can exacerbate asthma. Wash bedding regularly in hot water to eliminate dust mites, and consider hypoallergenic mattress covers. Supporting your lungs naturally is about creating a balance between what you put into your body and how you interact with your environment. From a nutrient-rich diet to simple breathing exercises and a clean, allergen-free home, these small lifestyle adjustments can make a huge difference in managing asthma. Remember, every step you take helps you breathe a little easier. Herbal medicine can be a powerful ally in managing asthma, but safety should always come first. Let's dive into the essential precautions to ensure effective and safe use. Consult a healthcare provider. Many herbs can interact with prescription medications, over-the-counter drugs, or even other supplements. For example, licorice root may increase blood pressure, while turmeric can thin the blood, which might not be ideal if you're on anticoagulants. Always discuss your plans with a healthcare professional, especially if you're pregnant or breastfeeding, managing chronic conditions like diabetes, hypertension, or kidney issues, or taking prescription medications. Share a list of all your current medications and supplements with your doctor to ensure there are no interactions. Start slowly. Everyone's body reacts differently to herbs. Starting with small doses allows you to monitor your body's response and avoid adverse effects. Begin with a low dosage of one herb at a time. Wait 24 to 48 hours to observe any potential side effects before adding another herb to your regimen. Signs to watch for include allergic reactions like skin rashes, itching, or difficulty breathing, digestive issues such as nausea, diarrhea, or stomach cramps, and fatigue, dizziness, or changes in energy levels. Be aware of allergies. Even natural substances can cause allergic reactions, especially if you've never used them before. For instance, people with ragweed allergies may react to chamomile, and those allergic to celery may also react to parsley or coriander. Conduct a patch test by applying a small amount of an herb-infused product to your skin and waiting 24 hours for any reaction. Try a small oral dose under supervision if it's your first time using an herb. Always check the ingredient list on herbal teas, capsules, or powders for potential allergens. Use high-quality herbs. Low-quality or contaminated herbs may contain pesticides, heavy metals, or mold, which can worsen asthma symptoms or cause other health problems. Look for certified organic labels, reputable brands with third-party testing certifications, and herbs packaged in airtight containers to maintain freshness. Buy whole herbs when possible, as pre-ground powders or blends may be diluted or mixed with fillers. Understand dosages and preparation. Incorrect dosages or improper preparation methods can reduce an herb's effectiveness or lead to side effects. Follow recommended dosages on product labels or as advised by a professional. Use the correct preparation method, whether it's brewing tea, making a tincture, or taking capsules. Avoid double dosing by combining herbs with similar effects, such as multiple anti-inflammatory herbs. Avoid prolonged use without breaks. Prolonged use of some herbs can lead to tolerance, reduced effectiveness, or even long-term side effects. For instance, licorice root can cause water retention and elevate blood pressure with extended use. High doses of turmeric may irritate the stomach over time. Practice herbal cycling by taking breaks after 2 to 3 weeks of use, especially with potent herbs. Be extra cautious during pregnancy or breastfeeding. Some herbs can stimulate uterine contractions, affect hormone levels, or pass through breast milk. For example, avoid herbs like peppermint oil or rosemary during pregnancy unless approved by a doctor. Focus on mild herbs like ginger for nausea or chamomile for relaxation, but only under professional guidance. Herbal medicine offers incredible benefits for managing asthma naturally, but remember, natural doesn't always mean risk-free. By consulting a professional, starting slowly, and using high-quality herbs, you can harness their healing power safely and effectively. Always listen to your body, and when in doubt, seek expert advice. DIY herbal tea for asthma relief. Ingredients: 1 teaspoon turmeric powder, 1 slice of fresh ginger, 1 teaspoon honey, 1 cup hot water. Instructions: steep turmeric and ginger in hot water for 5 to 7 minutes. Stir in honey for added sweetness and soothing properties. Enjoy warm for a comforting and lung-supportive tea. This tea not only reduces inflammation but also soothes your airways. Herbal medicine provides a natural and holistic approach to managing asthma, reducing symptoms, and improving overall lung health. While it's not a replacement for conventional treatment, it can be a powerful complementary tool. If you found this information helpful, don't forget to like, share, and subscribe for more health and wellness content. And let us know in the comments, what's your go-to natural remedy for asthma? Thank you for watching. Stay healthy and take care of your lungs.